So making a provisional restoration was a really big challenge for me in my practice. And so that's how I conceived of the separable fastener, which you've seen me demonstrate in multiple videos and a training video series. So the other thing that I used to find a really big challenge was cementing my TiBases into my zirconia prostheses and trying to keep cement out from the mating surface of the TiBase as well as the screw seat of the TiBase. So I figured a way to actually use separable fastener technology in the cementation of TiBases into the final zirconia prosthesis. So this is the technique for cementing TiBases into zirconia prostheses using a separable fastener technique. All right, so first you're going to monobond or prime the zirconia surface inside the wells that were milled out for those TiBases. And that just has to react with the zirconia surface for about 60 seconds. Then we also have to, so this is the separable fastener head. We also have to silinate the TiBase, but first we're going to put the separable fastener head into the TiBase and then use these protective plugs. And the separable fastener head is engaging the protective plug, and now you can see that we've blocked out the inside of the TiBase as well as the seating surface of the TiBase. Okay, so we'll just set that to the side, do the next for all four that we're cementing here. I'm just going to line them up next to each other. Okay, so now that I've got these blocked out, we're going to just take some monobond and rub it onto those TiBases. And you see how I'm just kind of rolling the TiBase? I'm rolling all four of them simultaneously until I have those TiBases coated with the monobond. And again, it just has to react for about 60 seconds. Excellent. Now I'll put the monobond to the side. Now we'll just get the TiBases positioned. Great. And now we're using an dual cure resin cement. And I'm going to inject the cement into the pockets, and then I'll inject it onto the TiBases as well, just coat the TiBases. And then I'm going to push those into the wells, and then I'll clean off the excess cement with a micro brush. And then I'm going to secure the prosthesis to the cast using the prosthetic screws and get this done in like less than 3 minutes. So it's been about 60 seconds. I'm ready to begin my cementation process. So we're going to inject and just fill that well with resin cement. Then go to the next one. So now I'm just going to put a little bit of cement on the TiBases here. I just want to get it circumferentially covered there. Now I can lift this up and just gently push those into place. See them get very good coverage of cement onto those TiBases. Now I'm just going to use a micro brush here. To remove the excess cement from around the TiBase. And we'll come back and remove all of that cement at a later time. Right now it's just a matter of getting it away from the TiBase. One of the reasons why I really like this technique is because I'm able to use a lot of resin cement and make sure that I have really good coverage on that TiBase, which will help us avoid having TiBases dislodge. So now that I've got all that cleaned up, I simply pull those separable fastener heads. We call these cementation aids. We pull those out, and now all those protective plugs just drop. Now I can go to the model and start securing all of the TiBases to the lab analogs. And switch out to my laboratory driver, just easier to use. And just give it a nice snug twist there on all of those TiBases. Good. And now since it's a dual cure, I could throw it into a curing box, or we can just let it set. And we're just going to let it set. It takes about five minutes for it to set, and I can go about and do something else. So super easy cementation of TiBases, keeping the cement out of the TiBase and out of the screw channel, out of the inside of the TiBase and off of the mating surface of the TiBase. So these are the Cementation Aids. And it's using the same separable fastener technology as the Smart Denture Conversions separable fasteners.